Let's go.
Okay. There are a number of risk factors for cardiac arrest. And as you know, the common factor in cardiac arrest is what we call arrhythmias. That is the way the electrical system of the heart beats. Arrhythmias can make the heart beat either slowly, very fast, or even stop all of a sudden. And there are so many risk factors for cardiac arrest. As I discussed earlier, the main causative factor is arrhythmia, that is ventricular fibrillation. In ventricular fibrillation, the heart doesn't beat in a synchronous pattern, so it beats in a way such that it cannot coordinate itself, so the blood doesn't flow, and then it could lead to the cardiac arrest. Other conditions that could lead to cardiac arrest are myocardial infarction, or generally what we term the coronary heart diseases, of which myocardial infarction is the most commonest. There are other diseases that lead to myocardial infarction, such as hypertension, obesity, diabetes. Generally these are conditions that will lead to coronary heart disease. In Ghana, management of cardiac arrest is a bit challenging because, as I indicated earlier, the arrhythmias are the commonest causes of cardiac arrest, but since we don't have defibrillators in our hospitals, even in our public places, it makes it a bit challenging. If you fortunately find yourself in the hospital, it can be managed easily in the hospitals with some of these defibrillators. But if you suddenly collapse in a public place, it's going to be very difficult for people to manage or help you. So basically, we encourage people to do is to do what we call a CPR. If somebody falls down, suddenly you check on the person. Hey, how are you? Are you okay? If the person doesn't respond or the person has fainted, you just check the pulse quickly, either around the neck or even on the wrist. If the person has no pulse, then you quickly do what you call, you clear the airway, you lift the chin up, and then you extend in the neck, and then you lift the chin, do a chin lift, and then the air will be able to open. And then after that, you do what you call a cardiac compression. Press on the chest, use your two hands, you press on the chest, using the nipple line as a marker, and then you give chest compression. You can give about 100 within a minute, doing it such that you don't break the ribs of the person. In the hospital as well, there are drugs which are also used to manage the cardiac arrest. Beside the defibrillators, there are drugs that can also be used to stabilize the person and to keep the person alive. Cardiac arrest can happen in children, it can happen to teenagers, especially those with certain genetic conditions or inheritable conditions where they have diseases of the rhythm of the heart, but it doesn't show too well. In certain situations, it may exacerbate and it may lead to cardiac arrest. But as we all grow, as we all age, because of development of some of these chronic conditions, hypertension, diabetes, coronary heart diseases, cardiac arrest tends to be more common as we age.